A degree is not skills. A degree is I've passed the requirements to get the degree. Now I'm going to use those fundamental knowledge to then go build skills. You can have a great resume and leadership responsibilities, and it's probably going to be weighted more than an MBA. The NBA gives you a ticket to the game, but you got to go out there and play.
So do you think that you learned more in school getting the MBA, or do you think that you learned more actually being in a role where you had to be a leader?
Yeah, it's just like, coming out of PA school, right? So you've learned a lot of things out of the textbook. And unfortunately, people are not a textbook. And so it gives you a skill set that you then have to go expand on. So, coming out of PA school, I had this fundamental knowledge base, but it wasn't really applicable to practice like it is, like the years of experience that I've gained. Same thing is true in business, right? You've passed the test, you've met the requirements of the degree for an MBA, but really until you go and apply it, you really don't have the skills. So a degree is not skills. A degree is I've passed the requirements to get the degree. Now I'm going to use those fundamental knowledge to then go build skills. And, business is completely different. It's a different vocabulary. It's different because you're not dealing with people, right? You're dealing with numbers and spreadsheets and processes. And it's really hard when you start putting people in those places of those spreadsheets and processes because people make things complicated, whether it's the variance in somebody's health or their needs. That's where it gets complicated. Same thing in business is easy until you start adding people to it, right? The principles of business are pretty easy, but you start putting employees in there, and that's where it gets really complicated. So it's very similar in a lot of ways to taking care of patients and taking care of their health.
Yeah.
It's straightforward until you start adding the people to it. So
Yeah. Thanks for tuning in to the Healthy Careers podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details. Well, and people are unpredictable, which I think is the biggest thing that anybody that I could give advice on being an entrepreneur and being in business is that you can plan everything to a T of like, this is how I'm going to do it. This is what my process is going to look like. Like, we all know the right way to do something. We all know the textbook definition of, how to cast or how to do a suture and all of that kind of stuff. But when then you have a patient who is petrified of that and doesn't want you to touch them and they're freaking out, right? Or they have a fear of being at the doctor. And on my side of things, it's like, I can have a difficult client or a candidate who just wants the star and sky and the moons and everything in between. And you have to figure out how to professionally and kindly deal with that while still focused on what is the outcome, right? Like, what do we actually need to accomplish here? What's the solution, given all of these extra things that we did not predict in this situation?
yeah.
And having the candor and ability to communicate effectively and find a way to keep your cool and not, freeze and be in an analysis paralysis around it. And I think it translates well that healthcare providers, they do this day in and day out with people. And so when I hear someone talking about like they don't have the skill set on the business side, of course you do. You have the hardest part of it figured out. It's just believing that you can do it in a different capacity, like you said, with new fancy words and corporate jargon and strategy and thinking more about the overarching big picture rather than just the patient itself.
100%. The providers are good leaders. They're leading their patients across a journey of recovery or improvement in their patient's life. And so you're exactly right. I mean, they've already developed a lot of leadership skills. They just need to apply it in a different realm. And that's in business. Because in business, it's also about, leading people. And, every person that you interact with have a physiologic, they have an emotional, they have a spiritual component to them. They have, a social, there's a lot of things, and you only can lead people to the extent that they're willing to trust you. And so, as a provider, you spend a lot of time trying to gain your patient's trust. Some of that trust is based on your position, right? Some of these positions come with an associated level of baseline trust. But then after that, it's really about the relationship that you create with the patient to take that trust up to the next level to where you can actually get that patient to basically put their life in your hands and trust that you are going to guide them and coach them, to appropriate decision making. Same thing in leadership in business, right? You have to gain the trust of your employees to lead them to ultimately make a decision on the employee side to get the best out of them. So
Yep.
you're exactly right. There's a lot of similarities, although both are equally hard. So